My name is Amanda Udy. I'm a graduate student at West Texas A&M, and I am recording my head-to-toe assessment. My patient is a 20-year-old male. Prior to starting our physical assessment, I have verified past medical and surgical history with a brief social history. I've also completed the general survey with vital signs, which were within normal limits. I've done height and weight, and I've also assessed vision on the Snelling chart, cranial nerve number 2, the optic nerve, and we've assessed 20/20 vision. So we're going to get started with the physical assessment. I do want to let you know I've got my little card. Mostly it's got the cranial nerve information on it. So looking at the head, I'm inspecting the skin, let's turn this way just a little bit. The shape of the head, I'm looking for any lesions, rash, no abnormalities are visualized. I am going to palpate just to make sure that we are symmetric. Okay. Alright, the frontal sinuses, any pain there?
No.
Maxillary?
No.
Okay. Alright, so moving on from that, I'm going to do the trigeminal nerve. And to assess that, we test sharp versus dull on the face. Okay, go ahead and close your eyes. And then I want you to tell me if you feel a sharp or a dull sensation.
Dull.
Okay,
Sharp.
okay,
Dull. Sharp.
alright. The trigeminal nerve, cranial nerve number 5 is intact. Alright, so moving on, I'm going to look at the head for symmetry. I'm looking at hair distribution. Again, like I said, I'm looking at skin. The eyes are symmetrical, they're evenly shaped, mouth is symmetric. So let's look at the eyes. The sclera are white. Looking at the pupils, they are both equal and round. We need to see if they are reactive to light, both independently and consensually. So looking at the eye, we're going to start with the left. Okay. So I am noticing the pupillary reaction there, and then it is consensual. And then on the right, again, and consensual. Alright, I want you to look right here, and then I want you to shift your gaze to the clock on the wall and come back. Okay, so I do notice the pupils accommodating for far vision versus near vision. And then, let's see, I want to test the 6 fields of gaze, which assesses the 3rd, 4th, and 6th cranial nerves, the oculomotor, trochlear, and abducens. So I want you to follow my pen light, okay, just with your eyes. Okay, and then back to the middle. Okay. The cranial nerves are intact. Visual gaze, he's got cardinal and all 6 gazes of vision. And then I want to look at the optic disc inside the eye. Okay. I also want to look, I think I've already told you the sclera are white on both eyes. And then looking at the conjunctiva, it's pink. Okay. Both eyes are nice and moist. No signs of infection or abnormalities. Alright, I'm going to look, I want you to just look straight ahead. I'm going to look into your pupil. Okay, open your eye just a little bit. Okay, red reflex is seen in the left eye. No papilledema noted. And then looking at the right eye. Again, that red reflex is seen. and no papilledema is noted. Okay, so moving on from the eyes, I'm going to assess the ears, inspecting the ears. Both sides, that they look equal, they set equally. I'm going to palpate, just looking for, any mass redness, anything that's unusual about the ears. And then I'm going to look on the inside to visualize the tympanic membrane. Okay, I'm going to pull back and up. Alright, the auditory external canal here is clear. I can see the tympanic membrane. It does have that pearly gray look. It looks nice and clear. And then looking on the other side, again, I'm going to come back and up. And okay, this one is completely blocked by a big ball of wax, so I cannot visualize the tympanic membrane on that side. Alright, I'm going to test the acoustic cranial nerve number 8. So I'm going to go behind you, I'm going to whisper on each side, and I want you to tell me what you hear, okay? Okay?
19.
Okay. And the other side.
23.
Okay. So the acoustic nerve is intact. Now we're going to do the Weber and Wren test. The Weber test, I'm going to place this on the top of your head there. I want you to tell me if you feel it on both sides equally, or if it feels different on one side than the other, okay?
Okay. It's equal.
Okay. Now for the Wren test, this is a conduction versus air, bone versus air conduction, which should be 2 to 1, or about 2 to 1. So I'm going to start by doing this behind your ear. Tell me when you stop feeling or hearing the vibration, and then I'm going to put it right here at your canal, okay? And then you tell me when you stop hearing the sound.
Stop. Stopped.
Okay. So we've got about a 2 to 1 ratio there for air versus conduction, bone conduction. All right, so we'll move on. Let's see, let's look at the nose. Looking at the external part of the nose, I see no obvious masses. I'm going to check the internal, checking for any lesions or mass or growths, infection, redness, and check that the septum is intact. Okay. All right. A little bit of redness on that right side. Go ahead and look down for me, or look straight. I want you to plug one side of your nose and take a good breath in. Okay, do the other. Okay. Sounds like maybe your right side's a little occluded, a little stopped up. All right. So we're going to test your olfactory cranial number 1 nerve to see how well you smell. Okay, so I'm going to have you smell something. I want you to close your eyes and plug up one side of your nose. Okay. All right, what do you smell? Do you smell anything?
No.
Don't smell any alcohol? Okay, do the other side. Alright. What are you smelling? Nothing? Okay. We need to evaluate that further probably. Let's see. Moving on, let's check your nose, not your nose, let's check your mouth. Say ah. Alright, uvula is midline. Okay, say ah again. Alright, lift up your tongue for me. Okay, and okay. So we're checking, go ahead and close your mouth. We're checking the hypoglossal nerve, and he was able to stick out his tongue, protrude, put that back in. And then we checked the vagus nerve, the uvula went up and down, and the glossopharyngeal, the gag reflex, those are all intact. And then, let's see, let's do your facial nerve. Go ahead and smile for me. Okay, and then puff out your cheeks. Okay, facial nerve is intact. And then I want to check your spinal accessory nerve. And I'm also going to check muscle strength at the same time. All right, push up for me. All right. So cranial nerve number 11 is intact, and we have good muscle strength on both sides. And then let's look at the neck. Again, inspecting the neck, I'm looking to see that the trachea here is midline, there's no deviation, and there's not. I'm going to feel, palpate very lightly here, and then I'm going to go around the back where I can appropriately assess the thyroid gland. Okay, go ahead and swallow for me. Okay, I'm checking for mass or swelling, tenderness. There's none of that. And then I'm going to check your temporal and okay, equal bilaterally at 2+, and then your carotid pulse one at a time. Okay. Okay, they're equal bilaterally again at 2+. So that completes the head, neck, vision. Oh, let's do the range of motion for your neck. Go ahead and try and touch this ear to that shoulder and go the other way. Okay. Try and touch your chin to your chest. Okay. And backward. All right. All right. I want you to push against my hand. Okay. And the other way. All right. So we have good range of motion, good muscle strength, 5+ muscle strength, full range of motion. All right, I'm going to have you lay down. And your upper part of your body just a little bit. There you go. Okay, I'm going to assess the jugular vein, jugular venous pressure for distension. Go ahead, look that way. Okay, so as I'm looking at this, I'm following the jugular vein up. It's not distended. It looks nice. He's laying it around a 30-degree angle. I'm going to place my ruler at the sternal notch. I'm going to come over here and go at the meniscus of this jugular vein. And let me turn it around where I can get it. There we go. And it's at just about 3 centimeters, which is where we want it to be. Okay. Okay. I'm going to go ahead and I'm going to have you sit up for a minute, and I'm going to listen to your lungs and do that assessment, and then we'll move on to your abdomen, okay? All right. Turn around for me. Let me see your back. I'm going to assess the posterior chest first. A little bit this way, there we go. So looking at the skin, inspecting, I do see some nevus or some moles, a little bit of acne scars, and being 20 years old, I think that's probably expected. But I don't see any obvious masses or deformities, so I'm going to start by palpating. Okay. On this side where we can, alright. Say 99 for me.
99.
Okay. And again.
99.
Okay, one more time.
99.
And again.
99.
Okay. And then test for chest expansion. Why don't you take a big deep breath for me? Okay. Let it out. And you notice my thumbs move. I can see that chest expansion. Tactile firmitus is what I tested for while I was palpating. And it was as expected. I could feel it, but not, it was equal bilaterally, which is what we want. I don't suspect any consolidations anywhere just by the feel. All right, I'm going to do my percussion next. And I'm just listening for that nice resonant sound. I want you to take a big deep breath for me and hold it. Okay, you let it out. Alright. Take a breath, and then when you let it out, hold it this time. I'm going to mark right there. I'm going to go back up. So this is the diaphragmatic excursion. About between here and there, this is where the diaphragm rises and falls during inspiration and expiration. Okay? I'm going to listen to your lungs. Okay? Just take a nice deep breath in and let it right out. Okay? Alright, so breath sounds are equal and clear bilaterally. And now I'm going to test bronchophony and egophony. So I'm going to have you say 99 on this upper part, and then we're going to change to E about halfway down, and I'll let you know when, okay?
Okay.
Okay? So say 99 for me.
99.
Okay?
99.
Do that one again.
99.
Alright.
99. 99.
Okay, go ahead and switch to E.
E. E. E. E.
Okay. So I could hear those as expected. They were equal bilaterally. None were any louder than the other. Again, I don't expect any consolidation in the lungs. Everything is clear bilaterally. Okay. I'm going to go back to your chest. Go ahead and turn around this way for me. Alright, I'm going to start with palpating. I'm going to use the tips of my fingers and the ball of my hand here. I'm looking for the ribs, and I'm also looking feeling for any masses or deformities. Okay. There's no abnormalities noted. I can feel the upper ribs here, so I know where to look. Alright, I'm going to listen to your lungs and your heart. deep breath in and out. I'll listen on the lateral. Go ahead. Okay. I'm going to listen to your heart sounds, and I have a cardiac stethoscope, so I can listen to both the high and low frequency just by pressing slightly harder and lighter with the stethoscope. So that's how I'll do this. Second intercostal space is the aortic valve. Okay. And then the pulmonic. Okay. The third space is Erb's point. And lighter. Okay. And then the fourth is the tricuspid valve. And a lighter. Okay. And then fifth intercostal space, midclavicular line here, is the mitral valve. Okay. So I listened for the higher and lower pitch tones. I heard no murmurs or any abnormalities. It sounds good. Just what you'd expect from a 20-year-old's heart. All right, so let's see. I'm gonna go ahead and palpate the PMI. Again, that's fifth intercostal space here, midclavicular line. I can feel that. Okay. If I suspected any heart enlargement, I would go a little further this way, but I don't. Everything is where it's supposed to be, and it sounds good. We are ready to move on to the abdominal. Okay, go ahead and lay down. I'm going to check your abdomen. So I'm going to listen first. Okay, all four quadrants of the belly. Listening to bowel sounds. Okay. And normal active bowel sounds. Okay. Now listen for the bruit of the renal artery. Okay. It's not heard. The abdominal artery. Okay. No bruit heard there. And then the right renal artery. Okay. No bruit heard. All right. So I'm going to move on and percuss the liver here. Okay. I'm going to start just above the umbilicus and move up, looking, listening for that sound once it starts sounding dull. Okay, right about there. All right. So I'm going to note this spot right here. And that's just about a finger width below the margin of the ribs. And then we're going to go up just inferior to the nipple line, and same thing, listening for that change in sound. Okay. So the space between here is about where the liver lies. It doesn't seem enlarged here. All right. Let's see. We're going to move on, and I'm going to palpate the belly now, light and then deep. Light checking for hernias or mass. Okay. And then of course we're looking for any tenderness, any pain. Okay. And I'm going to do a deeper palpation. Okay. And that spleen is not palpated. We're not really expecting it to be though. That might be an abnormal finding. And then the left kidney is not felt either. Okay. And again, the liver is just about a finger width or so below the rib margin there, costal margin. And the right kidney is not palpated. Okay. So again, the inspection of the abdomen, there's no abnormalities, there's no hernias, no masses noted, just looking at it. We're going to move on and do the lower extremity assessment. Okay, let's lift up this leg. Okay, we've got full extension of the knee. You can bend the knee, full flexion, lift your hip towards you. Okay, full flexion of the hip, and then I want you to turn it this way. Full external rotation there. Full internal rotation. Now hold for just a minute. Okay. Got good internal, external rotation of the knee, no more than expected. All right. I'm going to push on your heel here, on the ball of your foot. I want you to tell me if you feel any pain.
No.
Okay. Push against my hand. Okay. Pull back up. Okay. Let me see you lift your ankle forward and down, and then in a circle. Okay. All right. Now let's move your leg out. We've got good abduction and good adduction of that hip. Okay. Let's move on to this leg. Okay. Again, we've got full extension of the knee. We've got good flexion of the knee. Good flexion of the hip. External rotation. Good internal rotation. I'm going to let it back out. Got full extension of the hip. Alright, and then abduction and adduction of the hip. Alright, now let me assess this. Do you feel any pain?
No.
Okay. Push against my hand. Okay. And pull. Alright. And let me see you move your your ankle up and down in a circle. Okay. Alright, you can let that down. So we've got full range of motion of the lower extremities, all joints, and we've got good muscle strength, 5+. And when we checked the dorsiflexion with pressure, he felt no pain, indicating likely he does not have a herniated disc in his spine. Okay, so let's see, let's move on, and I want to, while we're working on that, let's check the cerebellar. I'm going to move your toes. I want you to tell me up, down, left, right, okay?
Okay.
This checks one of the cerebellar functions for knowing proprioception, where your extremities are, where you're moving to.
Right.
Okay. And then how about here?
Up.
All right. Okay. Let's go ahead and sit up. Okay. Let's see. I feel like I did not listen to your carotid artery earlier. Let me do that. Let me listen for the bruit. Okay. Just hold your breath. Take a deep breath and hold it. Okay. Listen at the other side. Okay. No bruit noted there. So we need to move on and do upper strength. Okay. Go ahead. Let's check range of motion. Let me see you lift your arms. Okay. Let's go behind your head. Okay. We've got full external rotation. Let's check internal. Okay. And bring your arms across We got full abduction, arms out. Okay, bend your arms towards you. Okay, got good muscle strength against resistance. Let's flex your wrists. Open and close your fingers. Okay, I want you to lay your hands down like this, flat on your, okay? And then we're going to test pronation and supination. I want you to move your wrists like this and do it quickly. Okay? Alright, you can go ahead and relax. That also tested the cerebellar function of rapid movement. Okay, I want you to squeeze my fingers. Don't break them, but squeeze them pretty good. Alright, got good muscle strength in the hands. Alright, put your arms up for me, or your hands up for me again. I'm going to make a number in your hand. I want you to close your eyes and tell me what it feels like I'm drawing in your hand, okay?
Okay. 6. 3.
Okay, you can rest your hand. So that checks the number object. Let's do point to point. I'm going to touch one of your fingers. I want you to touch that finger to your nose. Okay. Keep your eyes closed. Okay, and the other hand. Okay, so that cerebellar function is intact. Go ahead and put your hand up just like it is for me. I want you to tell me what this object is.
Key.
Okay. And let's see the other hand.
Pen or a light, something.
Okay. So the cerebellar function there is intact also. Let's finish up the pulses. Okay. I've already checked the carotid and temporal, so let's check the brachial. We got 2 plus, equal bilaterally, and then just leave it just like that. And check. Okay. Those are also equal bilaterally. Now I need to get to your knee. There you go. And just rest it, both hands, to check the popliteal. Okay, and then the other one. And again, while I'm looking at this, I'm noting skin color, hair distribution, that there's no rashes or lesions on his legs. Okay, popliteal pulses are equal and intact on both sides. And then posterior tibialis, also equal bilaterally, 2 plus intact. And then the dorsalis pedis are both 2 plus and equal bilaterally. Okay, let's test reflexes. We're going to start with the tricep. Let's lift your arm up here for me. I want you to relax it. Again, I'm looking for that slight muscle twinge. Okay. And then the brachioradialis here. Okay. Other side. Okay. And again, the brachioradialis. Okay. All right. I want you to close your eyes while I do this one. Okay. All right. And the Achilles. Okay. All right. So reflexes are intact. Go ahead and stand up for me. All right. Close your eyes. Okay. We're checking balance. This is the Romberg test. Lift your arms to the side for me. There we go. You can put them back down. Okay. He's able to maintain balance with his eyes closed. I want you to maybe turn around this way and take a step back so you don't hit your head. Okay. And bend down, touch your toes. I'm going to check your spinal alignment. Okay. So I'm inspecting. You can see the spine is midline, which is where we want it to be. There's no lateral curvature. I'm checking the sacroiliac joint for tenderness there. Also percussing right above the right above the renal, the kidneys on both sides. Just checking for tenderness. Go ahead and lift up some. Okay, the spine remains in line. Again, no lateral curvature. Go ahead and stand all the way up. And again, that spine remains in line exactly as we want it to. Okay, go ahead and turn around for me. I want to do the heel to toe test with you. So I want you to walk heel to toe over to the counter. Okay, we're checking gait and that he can maintain his balance while he walks. Okay, turn around, come back, stand on your toes for a couple of steps. And as quickly and whatever as you walk. Now, maybe go back the other way on your heels. All right, so all of the balance and gait tests are within normal limits. Okay, we've done reflexes, point to point. Okay. Well, I believe that concludes our head to toe assessment. Thank you. You can put your shirt back on now, and you have a good day.